closely related. He has been the India head for many group and has traveled extensively the world over. He's now an entrepreneur and promoter of Biohouse Solutions, which is part of Next Generation. So he has extensive knowledge on M&A activity, toll manufacturing, Make in India, and a whole host of initiatives associated with startups, which is going to be the future of this country. I would request Subender to be precise. We are slightly behind time for whatever reasons.
Absolutely.
And,
I was just about...
And talk to us about R&D productivity in the higher end of R&D.
Absolutely. Yeah.
Thank you. Please give my hand.
Thank you, Dr. Dua. And I also want to thank, CII for taking this opportunity to, have North India specific development program and gathering for biotechnology. When first time it happened, and somebody said, life science for North India. So I was like, started counting because, when I used to work with multinational companies or I work for my organization, or when you listen to the talks, so we talk about Biocon, we talk about, all the companies, which are based either out of south or west. So we need to have our own Biocons of north, and this is something which is completely missing. So I think I would really, thank CII for taking that opportunity. Somebody in the morning was talking about skilling in India. Now, we are a nation of 1.25 billion people. So 1.25 billion people, they need medicine, they need pharmaceuticals, they need diagnostic, they need nutrition. So we have to take care of so many people, but it's really difficult, I'm talking about skilling. When you talk to the kids, nobody wants to be in biotechnology much, everybody wants to go for computer science. Even my two kids, they want to go for computer science. Whenever I meet, anyone, any youngster, and I say, why you're a human being? Why you are not a monkey? And they start looking here and there, And after a lot of thought, I tell them, once they struggle and they're not able to figure out that it's your DNA. So we have DNA everywhere, but nobody understands the gist of life, the central dogma of life. Similarly, we have two equal hands. Why don't we have, this hand just keep growing, because we have apoptosis happening, at very specific cell division, cell number, this cell has to die. If that doesn't happen, we will have a very long hand. One hand will be very long. But we all start our life from one single cell, and that cell keeps dividing and makes a very beautiful human being. And nobody is teaching this to kids. So they don't have curiosity enough to get into biotech and get into pharmaceutical. I don't want to talk much about that, but point which I am trying to raise here is we need to involve these 1.25 billion people for becoming productive towards biotechnology, towards pharmaceutical, because it's need of the hour. When I used to work in all these MNCs, I've seen 80% of the reagents and instrument money is all going outside, because we as a nation, we have not done anything worthwhile to tap that. I'm not against MNCs, but what I'm saying is we should have equal opportunity or capability developed in this nation rather than being dependent on outside world. In the morning, Anirban was talking about, largest ANDA filings outside US happens in India. Largest number of US FDA approved facility, I'm not talking about now, I'm talking about 2005 when I got opportunity to work with Gary as Regional Director Asia. So I started talking in New York, saying that, we have largest number of US FDA approved facility outside US is in India. And nobody wanted to really listen to that. But that has happened. And what has happened is, now the focus is becoming more and more towards India. So we have Make in India, we have Digital India. We are talking about so many good initiatives. But what we need to do is we need to put all of them together and ensure that it percolates down in the value chain. For example, and I'll give you example, the government has started something called as GEM. So you are supposed to buy, government institutes are supposed to buy everything online. But if you go to GEM, a lot of people are not able to use it. So what we have to do is we have to embrace it, we have to popularize it, we have to find out ways so that more and more people can enroll and use that. We talk about Make in India. I started my career as a scientist, and then from scientist I got into commercial, then I got into MNC, then from MNC started my own company, and the company got acquired 6 months back, and we are expanding, we have investors. But doing all that, what are we trying to address? We are trying to address that we should have as many products made out of India, and it's very difficult, when you go, even our scientist mindset is not good enough to accept something Indian as of very high quality. So it is not only, talking about biotechnology, it is not only talking about pharmaceutical, it's all about how do we increase respect towards our own country's products? How do we increase respect towards what we are producing out of India? For example, there was a talk in the morning about bioclusters. So there is a biocluster which is in Faridabad, and then there is a biocluster in Bangalore. But the approval processes are so slow, and we ourselves, we are a registered startup. We have patents. I have myself filed 4 Indian patents. But the process is taking so long. It sometimes kills the whole enthusiasm of an entrepreneur, because it's a high cash burning game. And you just cannot, keep on waiting. It's very difficult to start a company, and it's more difficult to wrap up a company. And that's where, most of the entrepreneurs, I think, have immense problem. Somebody in the morning said, move from renovation to innovation. So it's a very good thing, but how do we do it? I think we as a team, we need to figure it out. Somebody talked about 40% attrition in manpower. Now, when I was talking about skilling, the example which I have given, we have to start at the grassroots level. And we have immense number of opportunities, who take hell lot of money from the students in the name of biotechnology. But they don't have money to do research. They are not providing technical training to the students, and that's where the skilling problem is. So we can certainly create more jobs. Somebody said even smaller countries have better regulation, and so we need to improve on that. We need to improve on ease on doing business. Some gentleman there, was talking about data. Now, just imagine. A country like US is facing a lot of problem addressing it. They were caught unaware, and suddenly this whole CA thing came up. So it's a beginning of a very big thing. And for that, we will have to gear up now. And I don't want to, have a very long story. But I certainly want to leave you thought, today, for example, you are having fever, so you are being given a drug. But is that drug 100% effective for you? It can be 40% for somebody, it can be 70% for somebody, it can be toxic to someone. So what is needed and what is going to happen is everybody's genome is going to be sequenced. It will be there in the cloud. You will be given a reference number. So moment you go to a doctor anywhere in the world, he will actually access that reference number. He will look at your genome, and based on that, he will say, take X drug, not Y. And this is where we have to get into the root. Just by talking, I don't think we can do much. We will have to execute at every level. Biotechnology and computer science, I think, will have to work together. Thank you very much.